Okay, we're here today to talk about the Knotless AC tightrope device. It's a rather simple device that's main focus is to be used to treat acute AC separations, where we're going to try and reduce the AC joint and see if we can get those ligaments to heal. You can see here we have the Knotless device that's coming through the large pec button, and as we go to the opposite end, you can see here that we have our clavicle button. We have a cadaver specimen here. We have mini C-arm coming in to try and give us a good fluoro shot so we can really localize that coracoid under the clavicle. Typically, I use the beach chair setup in the operating room. We have the standard landmarks in the shoulder. We have the acromion, the clavicle, and the tip of the coracoid. But rather than use the arthroscopy to kind of localize our drill hole and pass our fixation device, for this technique, we're going to simply use fluoro. And what that does is make it quicker and easier to accomplish the same goal. Typically, I'll take the wire that we're going to use to drill and I'll localize where we are for the coracoid. Now, the coracoid has quite a number of variations, and what we're trying to do is get towards the base of it, as you can see here, and I think there we're pretty well centered. Now, we can bring that up onto the top, and what we'll do is make a mark for our incision. And that's about all you need. You don't really need much for this procedure. Now, the one thing that's critically important is we want to be safe, and everybody knows that when we're drilling around the shoulder, we want to be cognizant of the nerves and vessels that pass by. So we want to make sure that we're drilling vertically through the two bones to the base of the coracoid, and we're going to try not to stray too posterior with that tip or too anterior. Either way is inappropriate. In addition, we want to be centered on the clavicle front to back, so that we're trying to center ourselves on the clavicle A to P and on the coracoid medial lateral. So we get a nice vertical compression vector to bring that clavicle down and allow the ligaments to heal. So we're going to make a small incision straight down to bone. Usually I'll use a freer elevator or something to clear off the periosteum a little bit so we have a nice landing spot for our clavicle button. And then I'll feel with the elevator the front of the clavicle and the posterior aspect of the clavicle so that I get a good impression that I'm in the center. The incision is really too small to even place a retractor in, so we're just going to go percutaneous on this. The next thing we're going to do is take a fluoro shot. And it really looks nice here that we're centered on both the coracoid and the clavicle. It's important in both the setup and the positioning and the confirmation by fluoro that you're going in the correct direction in multiple planes. So what we're going to do now is just drill quadricortically. And I'm going to leave the fluoro on so we can follow that. There goes the first cortex. There goes the second cortex. And now I can bounce. I'm bouncing on the base of the coracoid, and we're going to follow that through. There goes the third cortex, and there goes the fourth cortex. You can see it's an extremely controlled maneuver. We're going to take the pin out, and now we have this all-in-one device, so we're just going to exchange the two. Now you can use fluoro for this too. And here you see that we're at the top, and we're going to just tap down through the first cortex, through the second cortex, third cortex, and fourth cortex. At this point, we can remove the pin that holds that pec button on, and you'll see the pec button come free. In just a moment, we're going to take the pin out, releasing the button, and we'll release the device from the top in addition. Once we've done that, the handle is free. And I usually like to pull the handle out slowly so I can help have that flip the button, as you can see there on fluoro. I push down so the button flips, and then I remove that handle, and now we've flattened out that button on the undersurface of the coracoid very safely and effectively. Now on top we have the clavicle button, and it's through the knotless tightrope with the latest tightrope technology, and we're just going to slowly advance by adjusting tension on either of the limbs. As you can see on the fluoro, we've brought it down nicely. We've got excellent tension in the system here. We're not going to over tighten because we don't want to over reduce that clavicle. We just want to get it down to where the AC joint is reduced, symmetric to the opposite side. We've got great fixation. We don't need to throw any backup knots with the new technology, and we can just cut that there. We've got a low profile button. So there you have it, about as quick and easy as you can get. Nice and safe because we're using fluoro guidance. And we've accomplished a percutaneous AC joint tightrope with the new AC tightrope device.